these to come in. Great. Just give it about a minute or two and then we'll get rolling. See a couple people already coming in. Great. Fantastic. We'll give about a minute. I think people are starting to file in, so that's good. Yeah, we could at least start the introductions. Respect everyone's time, and then we'll let Professor Reif go. But yeah, my name is Mark Martino. I'm the chair for the Health and Life Sciences Subcommittee for the Urban League, Union League Club of Chicago's Public Affairs Committee. And I know you're used to seeing Dave Cohn's beautiful face, but you get mine today. So I'm very appreciative to have Professor Julian Reif here from the University of Illinois. As I have mentioned in my emails, this is our third COVID-19 program. We have one from Dr. McGuinn from Rush University, talk about what's going on in the front lines. We had Gary Sikich more on the business side. And I'm very pleased to have this talk about COVID-19's impact on Illinois. So something that's very relevant. And from the time I sent this email out about a week ago, already a lot of changes going on in Illinois, both for good and bad. So I appreciate your time. And Professor Reif, you have the floor.
Okay, well, thanks very much for inviting me to speak today on this important and, as you said, very timely topic. So I'll start just briefly by giving you a little bit of background about myself. So I'm an assistant professor of finance and economics at the Geese College of Business here at the University of Illinois. I'm also a senior scholar at the Institute of Government and Public Affairs. So most of my work is in the area of health economics. I in particular focus on evaluating the effectiveness of health policies and quantifying the value of health and longevity. So before I dive in, I do want to stress that all of the views I express today are my own. They don't necessarily reflect the views of either the University of Illinois or IGPA. So there's a lot of different things that we could talk about. So I'm going to touch on a lot of different points in my presentation today. I'd like to start by summarizing some of the evidence underlying what we know about COVID-19, at least as I understand it. I'll then present a simplified economic framework that I find helpful for grappling and thinking through the scale of this crisis. And then I'll talk about some of the fiscal implications that the crisis has for the state of Illinois and conclude with some policy recommendations. So there's a lot to talk about, but I plan to finish with definitely time left over at the end to answer questions. And that'll also hopefully allow us to go into some more detail on whatever issues people are most interested in hearing about. So let's start with some basics. All right? So I think the most basic question is understanding how many people are dying from COVID-19. So I've been asked many times by different people, whether the total number of deaths from COVID-19 is comparable to, say, a bad flu season. There are some measurement challenges here, right? So when first, for example, when someone dies from COVID-19, did the cause of death get properly attributed to the disease, right? Maybe the coroner recorded something different on the death certificate. Right? Another challenge is that maybe the person who died from COVID-19 was very ill and would have died anyway from a different disease the following day. I've also had people ask me, well, maybe the fact that we're all staying inside will cause a reduction in traffic fatalities. That's just as large as the number of people that are dying from COVID-19. So I think that the easiest thing to do is to just look at total deaths in the US population, as shown by this bar graph here. And this avoids all of these criticisms and concerns, right? So this is very simple data. It's just a count of the number of people that have died in this country on a weekly basis, going back to January 2017, right? So each blue bar shows you how many people died in that week. And then the orange line shows you the maximum number of deaths we should normally expect to see in that week based on how many people died in previous years, right? So if the blue bars are above the orange line, that means that something unusual is going on that is causing more Americans to die than normal. So, the first thing that you can see is that there was an abnormal increase around January 2018. So that corresponds to the 2017-2018 flu season. So in case you didn't know, the 2017-2018 flu season was actually the worst flu season this country has experienced in over 40 years. Right? So that flu season killed about 80,000 people. Now, if you look in the most recent month or two on this graph, we can see an even bigger bulge that begins sometime around the end of March. All right, so that's COVID-19. And even if we just eyeball this effect, we can see that it already looks worse than the worst flu season in recent memory. Although the good news, at least on this graph, is that the effect appears to be abating, at least for now. Right? Now this graph, comes from a tool that's publicly available on the CDC's website. So for those of you that are home on your computer, I put the link down here on the screen. You can go there and make this exact same chart for any state that you like. And if you do that, you'll actually see that there's a lot of differences in this effect across the states. For example, here is Alabama, right? We do see, some effect of COVID-19 in the recent months, right? But here, it looks pretty small. We can make the same graph for New York City, right? And then here we see just an astounding increase in the death rate. That's of course unsurprising for anybody who's been to New York City Hospital recently or has been reading about the situation over there. We can also make this graph for Illinois. All right, so that's relevant. This is the state that we all live in. Here we can see again a pretty clear effect of COVID-19 on total deaths. This graph looks pretty similar to what we saw for the country as a whole. So overall, these graphs show that that we've seen a large increase in total deaths so far from COVID-19. It already looks worse than the worst flu season we had in over 40 years. But so far, it doesn't look 10 times worse. And at the moment, at least, it does look like we're recovering from these graphs. Now, the main concern, of course, is whether there'll be another resurgence. Right? And there is certainly historical precedent for this concern. So this graph shows you the death rate that for the infamous flu pandemic of 1918. Some of you may know, for that pandemic, it was actually not the first wave that killed most of the people, but it was the second wave. Right? And so that's the main concern with COVID-19. Will there be a second wave that may still kill a lot of people? How do we know whether that second wave will arise? Well, for starters, it will be helpful to know how many people have been infected, and even more importantly, right, how many people could still be infected. And then we need to know how many of those people who've been infected are likely to die or at risk of dying. And unfortunately, we don't know the answers to these questions as much as we would like, right? And that matters a lot, right? If, for example, if you consider the extreme case where 100% of the population has been infected, well, in that case, of course, sort of a silly example, the pandemic is over, nobody else is going to die. At the other extreme, if it's very, very few people who've been infected, then perhaps we've only seen the tip of the iceberg. Unfortunately, answering this question is tough because it appears that a lot of the people who are carrying the disease are asymptomatic. Right? So you might have had the disease and not even known it. All right. So what we need to do to answer this question is basically randomly sample people from the population, healthy people and sick people, give them an antibody test and see who has been or is infected with the COVID-19 disease. So there have been some studies that have started doing this. As we would expect from the data I just showed you for total deaths, right, there is a lot of heterogeneity across cities and across states. All right, so the estimate for New York City, at least the most recent one I saw, is 20%. Boston is 10%. But in Boise, Idaho, the estimate is 2%. Right? Now, I do want to stress that these estimates themselves may be quite flawed. Right? In some places, the infection rate is changing quickly, so these estimates may already be out of date. But more concerning is that it's hard sometimes to ensure that when you're conducting these studies that you've obtained a representative sample of the population. All right, so if you're doing a study that's measuring people to see who's had COVID-19 in the past, a big concern is that sick people or people who were sick might be more likely to participate in your study. Right? And if that's true, then that's going to inflate the size of these estimates. Another challenge is that these tests suffer from false positive rates, could be as high as 1 or 2%. So that makes it hard to know, for example, whether this Boise estimate is a true estimate. Is it really true that 2% of the Boise population is infected, or is it an artifact of these testing procedures which have false positive rates on the order of 1 or 2%? Now, since we aren't sure how many people have been infected, it's of course also hard to tell exactly how fatal the disease is. If we look at the current estimates that the CDC is publishing on its website, last time I checked, they're estimating a fatality rate range of anywhere from 0.2% to 1% for people who are showing symptoms. So if you're showing symptoms of this disease, you have somewhere between a 0.2 and 1% chance of dying. We can sort of replicate this calculation by just looking at total deaths also. If you look at New York City, for example, those excess death graphs that I showed you before suggest that about 20,000 more people this year have died than normal in New York City. Right? So if there's 9 million people in New York City, and if 20% of them have been infected, then if you put those numbers together, that implies a fatality rate of about 0.7%. Right? So that's sort of the best guess we have for the disease at the moment. There is quite a bit of consensus, from what I can tell, that the virus is a lot deadlier for the elderly and for people with comorbidities, so people who are suffering from other chronic conditions already. And so one reason why we may be seeing such a large range of fatality estimates might be because areas with larger populations of old people will have larger fatality rates. And so as a baseline comparison, the typical flu has a fatality rate of about 0.1%. But this is important to remember, we have a flu vaccine, right? And the flu vaccine greatly limits the number of people that can be infected. And at the same time, the vaccine helps halt the spread of the disease. We don't have a vaccine for COVID-19. So if it spreads rapidly, it still has the potential to kill a much larger number of people than it has so far. So that's the sort of overview of the health data. What about the economic impacts that we're seeing so far? There have been some data that have become available for this. As I'm sure you're all aware, the impact is enormous. So on this graph, the red lines in these figures show you this year's unemployment claims. So on the left is for Illinois, on the right is for the United States. And then for comparison, the blue and the gray lines show you unemployment claims in 2008 and 2009, which was the most recent recession, right? That's the financial crisis. You can see that the number of unemployment claims today has just dwarfed the number of unemployment claims we saw in the last recession. And actually, my preferred measure is to look at administrative paycheck data. So essentially, these data are measuring who in the United States is getting a paycheck and who is not. And if you look at those data, they estimate that 22% of all workers in this country lost their jobs in the first couple months of this crisis. That's about 29 million people. So it's really hard to overstate how astounding that figure is. So this graph for comparison shows you what the employment declines look like for every recession that we've had going back to World War II. Right? So this is the last financial crisis, 2001 recession, etc. Right? And for all of these recessions, all right, the most we ever saw in the first couple of months was an employment decline of up to 2%. Right? So this is more than 10 times worse than that. Right? Even if we were to look at the entire recession period, the most we've ever had was a total employment decline of about 7% for a previous recession. Right? So this shock that we're looking at really is unprecedented in terms of the size of the effect. Now, of course, this is also a quite different, very unique kind of shock. People right now are being laid off because their business was ordered to close, or because the business was ordered to minimize operations due to public health concerns, right? And that was never a factor in any of these previous recessions. And naturally, the big question is how long this unemployment will last, and whether or not there will be a quick recovery or a prolonged depression. Right. So that's, again, a brief overview of the basic health and economic data that's been collected so far. It's very clear that COVID-19 is bad news. The question now is, what should policymakers do about it? So, I think we can start, or at least I would advocate starting by recognizing that the costs of this disease at a very high level take two basic forms. So first, there is a cost of the health and lives lost due to the disease. And second, there's a cost of the efforts that we are taking to prevent the spread of the disease. So these efforts include things like social distancing, stay-at-home orders, business closures, etc. All right, so both of these are important costs, and we need to acknowledge that there are trade-offs. So, whether we like it or not, it's quite possible or likely that reducing one of these costs may increase other costs. All right, so how large are these costs? Well, let's consider the cost of the shutdown first. If you look at some of the estimates that have been published of the economic costs of these shutdowns, they estimate that if the shutdown were to last for a whole year, the shutdown cost would be $6 trillion or about $20 billion per day. Right? So that's a humongous cost. Right? The US GDP is $20 trillion. So every day that we're shut down, that's costing us about a third of our total economic output for that day. Again, that's probably not too surprising given the unemployment numbers that I showed you on the previous slides. Also, I should emphasize that this $6 trillion estimate, that doesn't account for potential long-run costs such as the effects of kids not being in school. So I think the first takeaway here is that anything that helps us avoid or reduce the length of the shutdown is enormously valuable, right? To the point that price is almost a non-issue, right? These numbers are so big. So for example, these numbers suggest that it's worth spending, up to $500 billion to speed up the development of a vaccine by a single month. All right, so not $500 billion to develop the vaccine, that's $500 billion just to speed up its development by a single month. All right, avoiding shutdowns is very valuable. Now, what about the health costs? So as a baseline, let's consider a scenario where society does nothing and we let the pandemic run its course, right? And suppose that if we were to do that, 60% of the population gets infected and that the fatality rate is 0.5%. All right, so that seems to be in the plausible range of the numbers that we have currently. So that would imply a loss of just under 1.5 million lives. All right, so how do you compare that to the $6 trillion figure from the previous slide? So as an economist, I think it makes sense to look at how much people are willing to pay to reduce mortality risks. So the basic idea in the economics literature is to compare, for example, two people with similar backgrounds, but one of whom works in a risky job like logging, the other one works a desk job. And the question is, by how much more do we need to compensate the person who works in the logging industry, right? So doing that calculation gives us an estimate of what the average person is willing to pay to reduce risks to their life. So if you take the estimates from the research that's been done in that area, apply those estimates here, then that would imply that the cost of these lives lost corresponds to about, again, $6 trillion, right? So roughly the same size as the economic costs we calculated on the previous slide. So again, this tells us that any progress we can make on treating this disease or preventing it is very, very valuable. All right, so I'll say a little bit also about some specific consequences for Illinois. Most of the numbers I've showed you so far are for the US as a whole, or you could say for Illinois society as a whole. I think there's also questions as to what the fiscal implications are of the crisis for the Illinois budget, which even during normal times can be quite hard to balance. So I think it's helpful to sort of break that impact down into what are the effects of this crisis on revenue in the state and what are the effects on spending. Right. So I'll talk about revenue first. So as a benchmark, just for background, total revenue for the state of Illinois last year was $38 billion. So that includes money that the state also gets from the federal government. Most of this revenue comes from sales taxes, and income taxes that the state levies on individuals and businesses. Now, Illinois is quite dependent on income taxes relative to other states. So that means that its revenue is more sensitive to changes in the economy. In particular, large reductions in income, which we expect to happen given the large increase in unemployment and all these business closures, these large reductions in income will translate into large reductions in state revenue. So some of my colleagues at the Institute of Government and Public Affairs have run some numbers to forecast what that reduction might look like. And so they've estimated that the reduction in state revenue over the next 2 years could range anywhere from a reduction of $4 billion up to $14 billion. All right, so that's a very large fraction of the state's total revenue. Now, this range, as you'll notice, is quite large. That reflects uncertainty. So forecasting this loss is tough because, of course, we don't know how long shutdowns will last. As we reopen, will there be another shutdown again in the future? It's hard to know how easily the economy or how quickly the economy will be able to return to normal. Nevertheless, from these estimates, it seems clear that there's a good chance that state revenue will decline quite significantly. Now, what about the spending side of things? Here, I think, at least in the short run, the situation is a little better, although I would again expect that it's likely to increase for at least two reasons. So one is if people continue to remain out of work, then a lot of those people will eventually be enrolled into Medicaid, which is an expensive program that's funded by the state of Illinois. The second reason is that the state may have to increase its contributions to its pension funds. All right, so as of last year, the assets in the state pension funds were only sufficient to pay for about 40% of the state's promised future pension payments. And those assets have declined in value this year because Illinois has invested its pension funds into risky assets like equities that have declined in value following this year's decline in the stock market. So, if there's no recovery in the stock market, then the state is going to need to increase its required contributions in the future. So, but again, like I said, I should note that both of these effects, the enrollment increase in Medicaid and the increase in pension contributions, those are unlikely to be big problems in this particular year. If that happens, those are things that are likely to matter more in the coming years. What about local governments? So local governments, right, their revenue sources are different than the state government. A lot of their revenue comes directly from the state, and they're also dependent on local property taxes and sales taxes. So the state revenue is likely to go down since total state revenue has gone down, as I mentioned. But another big problem for local governments is that they will be hit pretty hard by decline in the sales tax revenue. All right, so that's caused by, for example, the decline in consumer shopping. All right, so that's probably the most significant immediate thing for local governments. Over the longer run, if businesses remain closed, all right, then that's going to reduce revenue from property taxes as well, although that effect will probably take a little bit longer. Now, some of this is going to be offset by relief from the federal government. All right, so the federal government has provided a lot of significant support to the states, including Illinois, through the CARES Act that was passed, I believe, back in March. So Illinois, so both the state of Illinois and the local governments here received just under $5 billion in aid from that recently passed CARES Act. And the federal government is also increasing its support for the Medicaid program. So normally here in Illinois, the federal government pays for 50% of Medicaid, and that's going up to 56%, at least temporarily. And of course, there's also an assortment of different programs that the government has made available to businesses. So these programs will make loans to businesses. In some cases, these programs are even making direct cash transfers to the businesses. But as we saw on the previous slides, right, Illinois' revenue decline alone, right, may exceed $10 billion over these next 2 years. So, there's a very good possibility that, even this, large amount of aid from the federal government won't be sufficient to cover the state's financial shortfall, which means that other steps will have to be taken to fill that gap. So what does that mean for the current state of affairs? Whether we like it or not, Illinois and other states are beginning to reopen. And the key challenge is to find a way to do this without suffering a resurgence of the disease. Right, so how should policymakers do this? So I think a useful starting point, at least in my opinion, is that it's important to emphasize that any technology that helps us achieve this reopening successfully is enormously valuable, right? Given these numbers that we're looking at, right? Anything that helps us is worth a lot. It doesn't have to be a fancy technology, right? So face masks, for example, are a very simple technology. I think encouraging people to wear face masks is a no-brainer, right? Masks cost almost nothing. And although they are inconvenient, I think it's fair to characterize the cost of that inconvenience as, pretty trivial compared to the trillions in costs that we were looking at earlier. Right? I think it's also prudent to prohibit, large gatherings at places like music concerts, et cetera, at least for the time being. In terms of reopening businesses, it'll be valuable to identify the ones that pose the least risk of spreading the disease so that they can be opened first and most quickly. There has been some research on this already using aggregated cell phone data to identify businesses where customers are spread out across the day, versus, say, businesses that have concentrated groups of customers that arrive at the same time, right? And so some of that research may be able to help us make these decisions in an informed way. Given the havoc being wreaked on our economy, I think it's also quite clear, again, that a vaccine would be enormously valuable. Unfortunately, vaccines frequently take years to develop, and they're risky for pharmaceutical firms to invest in. And it doesn't help that pharmaceutical companies have never created a vaccine for a coronavirus before. All right, so it might take some time. So in order to ensure that a vaccine arrives as quickly as possible and that we're able to distribute it to everybody as quickly as possible, I think it makes a lot of sense for the government to make a commitment, or a so-called advanced market commitment, to these companies that it will buy a set number of vaccines at a fixed price. Right? Now, this will cost billions of dollars, most likely, so it's something that the federal government would have to do. But remember, even just bringing the vaccine to market 1 month earlier is going to save the country many, many times that amount, right? It's worth hundreds of billions of dollars to just bring the vaccine to market one month earlier. So I think that would be money well spent. I think the last point I'll make here is that we really need to collect much better data, right? It's very important and valuable to know and understand how many people have been infected, right? How does this disease spread? Who is most vulnerable to the disease? All right, so there's some recent emerging evidence that suggests nursing homes represent, for example, a very large fraction of the deaths. All right, we need to pin these numbers down, right? We need to make sure the nursing homes have the protections they need. More generally, I think it's important for the state and the country to invest more in testing, right? So testing people will reduce uncertainty, which is good for business. Remember, we only need infected people to stay at home to avoid infecting others, right? But if we don't have testing, then we don't know who the infected people are. And this is not easy to do. It's probably not enough to just make these tests available, right? Healthy people probably are not going to show up to take these tests without some sort of an incentive, right? So people and states and the government need to think about ways to encourage people to take these tests. Right, given how much money this crisis is costing us, we should be willing to pay people quite a bit of money to get tested. Right, it really is quite valuable. So I think that is all I put together on these slides. So I'll stop there and open it up to questions.
Thank you so much. Do have a couple questions that have come through. Please answer them if you're able to. If not a problem. One of them is infection. So, do we know that infections will result in immunity along those same lines with vaccines?
It's certainly not my area of expertise. Sure. But my understanding is that it's very likely that if you've been infected, that you will be immune from the disease in the future. I don't think we know that with certainty.
Sure.
But I think that's our bet at the moment. And in terms of a vaccine, so we of course don't know if there will ever be a vaccine. I can tell you that in the past, developing vaccines for other diseases, like Ebola, et cetera, many of these have taken years, 5 years or even 10 years to develop. So there is, at a minimum, I would say, a good chance that it could take a while before we get a vaccine. We certainly do not want to make any plans we don't want to assume that it will be a vaccine available in a couple months. That'll be great if one is available, but I would not want to count on that.
Another follow-up question to that is, like you said, I've heard that there's been some preclinical data in animals, and I believe they just had positive results from human trials recently. What would you say the health economic consequences if there is no vaccine, or if the vaccine doesn't really, doesn't create antibodies in those that we thought? What would be some negative consequences from that?
Yeah, so I think it'll be quite negative. It'll be a big negative shock if it turns out that the disease is with us for a while. But I think that's a real possibility, so it's important to prepare for that possibility. I think that's one of the reasons why testing is very valuable, because what does work, right? The best way to not get sick is to not get infected, right? And you're infected by being around other people who have the disease, right? So if you have a large amount of testing, right? So at the extreme, if everybody in the country was getting tested every couple days, right? And then if you test positive, you stay home, right? After a period of time, that could be enough to stamp out the disease. The problem is that it appears that there's a large number of people who are infected, they don't show symptoms, and then they go and they infect others. Sure. And that's what makes it very difficult to control this disease. But I think with testing, it's possible. Actually, we've seen countries like South Korea and Taiwan do this quite effectively. It is a big undertaking, to be clear, right? It's not easy to conduct millions of tests a week. It would require a very large investment on behalf of the government. But again, when you're talking about trillions of dollars in costs, I think investing, tens or even hundreds of billions of dollars into this type of infrastructure, to me, it seems well worth it.
More on the, I would say, in the health economics and health impact. Do you have an estimate on the health impact from those who are putting off elective surgeries, those who are putting off doctor visits? We've heard that I think cardiac events have gone down, but it's also because they're also not being seen. Do you have any insight on that?
Yeah, I mean, that's an excellent question. And I think there's going to be a lot of interesting research papers looking precisely at that. What we do know is for sure, elective procedures have gone way down. Actually, for almost the first time ever in US history, the total amount of spending on healthcare has gone down as a result of these elective procedures, right? Even in past recessions, when a lot of people lost their jobs, we did not see that. So the healthcare sector is certainly suffering greatly right now from a loss in revenue from this reduction in elective procedures. Now, some of these, of course, will presumably get made up in the future as people start returning to the hospitals. I think you would have to imagine there is a health effect from this postponement of procedures. But I think it's hard to speculate as to how large that will be. I think it'll make for a very interesting research study to help us understand the value of these procedures.
Certainly. We've also heard on the news and through some initial governmental data about the impact on certain races, certain zip codes with COVID-19. Do you have any insight or information about that?
Yeah, so there does appear to be a lot of evidence that many of the costs of this epidemic are not being equally shared. So there are costs all across the spectrum, but certainly there are some groups that appear to be bearing more costs than others. So again, depends which part of the country that you look at, but I've seen data showing that people working in the healthcare sector, also in many areas of the country, people working in essential jobs, which are more likely to be populated by minorities, for example, are also suffering increased rates of the disease compared to the population as a whole. This is also true, by the way, if we look at the job losses. All right, so I showed you that figure before, showing that there's been a 22% reduction in employment in this country, so which is again, this is a massive effect. That's not equally shared everywhere. So there's been a reduction in people at the top of the income scale, but it's much less than 22%. If you look people on the bottom, quartile or quintile of income, there the loss is bigger than 22%. So there is for sure differences in who's bearing the costs of this epidemic.
That's good. Yeah, it's good to know. And unfortunately, we've also seen inner cities, the south and west side have gotten hit very hard as well. And with high rises and the housing access that's contributing as well. A question I had also sent to me was, sure, yep. Do you believe or do you not believe that COVID-19's disproportionate impact will drive a societal change towards greater governmental programs? Are we going to be more in governmental reliance than maybe we were before? And even when we come out of this.
Yeah, I would say probably, all of y'all's guesses on this are probably about as good as mine. I think the big question in my mind about how permanent this will change, behaviors and sort of relationship with government, things like that, is going to probably depend a lot on how long this crisis lasts, right? So, if a vaccine comes out in a couple months, right, or if new data comes out that allows us to address this this crisis more easily, it might be that everything's back to normal in a year. I don't think that's likely, but if it happens, then I think this this goes away quickly. If there is a situation where we have to live with the disease for a few years, that's more likely to make or have permanent changes.
Sure.
Certainly if you look in history, of course, pandemics are nothing new. We haven't had one in a while, so it's new. So it's new in terms of recent memory, but certainly it's not something that society hasn't had to deal with before.
Yeah, definitely. Another question that came through was, what economic programs should Chicago consider to accelerate the reemployment of our workforce? Is there an area that needs to be invested in more?
Yeah, so I think as the big question with the reopenings will be understanding, figuring out which businesses are the safest ones to reopen. And so there's actually been some interesting research in this area that I believe I alluded to in the presentation. Kate Baker and co-authors have looked at cell phone data to see basically which businesses have the largest numbers of people flowing through them at different times of the day, right? And so the basic idea is that if you're a business where you have just a small number of people coming there throughout the day, you're less likely to spread the disease or catch the disease there than one where, for example, everybody arrives at the same time for happy hour, let's say. And so to the extent that you can identify these different types of businesses, I think it makes sense to reopen the ones that pose the least risk first, or at least reopen them faster and more completely. And so those are areas that you can expect to have more employment in. But I think also, we were talking before about permanent changes. I do think there will be some permanent effects of this on how people work and where people work, regardless of how quickly we return to work, right? So I think, we've now had a lot more people working from home, for example. Businesses and individuals may have learned that working from home is actually easier or more doable than they thought it was before. There are a lot more people getting delivery these days than they used to. They may find that they prefer that, and then the increased employment in the delivery industry will also perhaps be with us to stay for a while.
Very interesting. Very, very true. I've heard that as well, that I think business practices are going to change a little bit. I predominantly work from home. I do work trips. And I was told, like, your work trip just to have a 30-minute meeting, that's likely out the window now. Like, and they're working from home. A lot of people are in professions where conceivably they could work from home. Mm-hmm. I mean, obviously there's some jobs you can't, but it's just interesting how that will shift. I think it will shift.
Yeah.
Another question that it's kind of a piggyback to what you were mentioning with pandemics, and we haven't had one in a while, but we've had pandemics that we've learned from. So from an economic standpoint, what lessons from history will help us manage this new reality? And if there's a next pandemic?
So probably the most recent pandemic that would be, I think, comparable to this one in terms of the the effect or notoriety it had was probably the 1918 pandemic from 100 years ago. And the challenge there, of course, is that society was quite different. So it's difficult to draw economic lessons from that one. There have been, smaller flu pandemics since then. There was a pandemic in it was 1957, for example, and another one about 15 years later. But we did not have economic shutdowns that resulted from that. So this really is, there is no precedent for it. Like we saw on those graphs, we've never had a recession where you had 22% of their workforce laid off in the first couple months. All right, so it's really a new area of research. I would say that in some sense, you want to think about this crisis almost not as a recession, but more not look to other recessions for how to handle it economically, but maybe look more at disaster. It's more like a disaster, right? So like when a hurricane hits a city, right, and destroys lots of things, or people are out of business all of a sudden right away. There wasn't any underlying economic problem with the city. It just got hit by this unexpected storm. In some sense, the US is in that situation. There was no underlying problem economically. The problem is that we got hit by this unexpected, unforeseen event, and we may be able to rebound quite quickly. There's been, our infrastructure has not been destroyed. Everybody still has the same knowledge that they had before. So I think there's a hope that, things could get working again soon. But again, I think the risk is, will that be accompanied by a resurgence of the disease, right? You could have a situation where you start going back to work quickly. If there is a second outbreak and then things get shut down again, that's going to be terrible for the economy. You can imagine being in sort of a yo-yo situation where we're swinging back and forth between opening and shutting down, opening and shutting down. That would be very bad for the economy because that will generate a lot of uncertainty, right? Businesses don't like uncertainty. It's impossible to run a business if you're under threat of shutdown every couple months. So.
Yeah, and I do think that my significant other, my fiance, works in a hospital, and they've rewritten policies and procedures based upon this, and they've updated them. And whereas we hope we don't have to go through this again, there's at least now we have some precedent to go off of. Yeah. And then also like with 08, 09, with the financial crisis, I mean, putting political opinions aside, that was more, I would say, a failure of the system, where this was an identifiable cause that came in, swooped in, and obviously caused a lot of health consequences, but it caused economic consequences. So they're like, well, we're rebounding quickly. Well, it's also because it's a very calculated, reason for that. Another question that came through is, how will this pandemic impact the pension costs? I know that's been discussed a little bit, the financial implications in Illinois, and pensions are already being hit hard. How would this further impact that?
Yeah, so I think the immediate hit that the pension costs take is that Illinois, as I mentioned, we've invested our pension assets in the stock market, right? So the hope is that the stock market will grow quickly, and that'll help us address this underfunding problem that we have with our pensions. Problem, of course, about the problem with investing in equities is that they're risky, right? You may do very well if they go up, but you will also lose a lot of money if they go down. And the crisis is a situation where we've seen a very large decline in the stock market, although some of that has recovered. So I would say the first order thing has been that there's been a reduction in the value of the assets that are used to fund the pensions. The state will have to make, if there's no recovery in the value of those assets, the state will have to make additional contributions to the pension fund in order to make sure that it doesn't become even less funded than it is. Now, there has been some talk about, federal bailouts of the states. I don't know, if that has any chance of happening or not. There's no precedent for the federal government bailing out a state. If that happens, you could imagine that one of the items on the bargaining table is a reform of the pension system. Um, Again, there's sort of no legal precedent for how that would work, so I don't know how likely that is, but you can imagine that if there's a bailout, that question will arise.
Certainly. Yeah, heard that with the recent budget that was passed, that it is based upon the fact that we might be getting a federal bailout, but that's still uncertain. Unfortunately. A question I have also is, kind of with the reduction in like cardiac procedures, cardiac events along those lines. Have you seen anything from a health or economic perspective about domestic abuse, child abuse? I've heard, if I don't have any data to support that has gone down, but might actually be still occurring at a higher rate, especially with stay-at-home orders.
Yeah, so like you, I haven't seen any data on it.
Sure.
My understanding is that a large number of child abuse reports are reported by schools, right? So kids are at school, the kid has a mark on him or her, and then the school calls the authorities. Since kids are not in school, right, that's not happening. And of course, more generally, kids are around their parents more often now. So I think it's a very plausible thing to worry about, but I haven't seen the data on it. Unfortunately, we might never know. It's a hard thing to measure, but I agree. I think it's a reasonable thing to worry about.
Certainly. Any other questions from anyone? Please put them in the Q&A. We've definitely hit a good amount. Yeah, not seeing any more come through. I'll give everyone about 8 minutes back of their afternoons. Professor, I sincerely appreciate you coming virtually and speaking to us, talking about really COVID's impact on Illinois. We're in a different place than we were 2 months ago when we thought that the world was ending. We know a little bit more now than we did before, but there's still a lot we don't know.
Yeah.
Appreciate your work you do with IGPA and your colleagues as well.
Mm-hmm. Right.
And also, just a question did come through, but I will talk with Brian Williams from IT about getting the recording and the slides that hopefully we can disseminate. Would you be willing to share those, or is that proprietary?
I'm happy to share the slides.
Okay, very good. And then also there will be a recording as well from this, so that might actually suffice if it's through the recording. We might not need an additional. You don't need to send me the slides or anything, but I'll talk with our IT department more about that.
All right.
Very good. Everyone, thank you so much. Professor Wright, thank you so much. Really appreciate your time and your expertise.
Well, thanks very much for inviting me.
Thank you. Everyone stay safe and stay well. I think we're